Hey, nurse CEOs, it is me, Crystal P, the Beauty MP, coming back with another video for you guys. Also known as the Bedside Rescuer. I have a few names. So for the spa, I am Crystal P, the MP, and for my amazing nurses that I help coach, I am the Bedside Rescuer because, as you know, it is my goal to rescue all burnt out bedside nurses and nurse practitioners from either the bedside or the clinic. So I'm coming back today just to talk to you guys about an interesting article that I read about why telehealth and nurses should go hand in hand. I've been doing a lot of research and have found that one third of the workforce of nurses are slated to leave the bedside this year. Now, we all know that this was coming. Has been brewing since pre-COVID, but COVID just blew the lid off of it. And now us nurses are really burnt out and tired and trying to find another way. A lot of nurses have been leaving the workforce, but leaving as being a staff nurse, going back to being a travel nurse because the money was much better as a travel nurse. But now with those travel nursing assignments not paying out as much as they once did with COVID, nurses are having to decide if they either want to leave the bedside altogether or come back to being a staff nurse. But what I really have found enjoyable and found that for the right nurse, that telehealth and telemedicine is a great alternative to do nursing in a different way, but to still be a nurse and still be able to help your patients. So I know there is a lot of information out there, especially the telehealthpreneur. She coaches all my nurse practitioners on how to start businesses as nurse practitioner, start businesses in telehealth as nurse practitioners. But I also wanted to have an option for nurses because I had a student who was in my IV hydration class who actually blew our minds because she told us that she was a telehealth nurse for a hospital. Like, she actually worked for a hospital, but she worked from home. So we were questioning her, and I am going to work on getting her to do an episode with me and kind of walk me through where she works. So if you guys are interested in that, but B, how it works to have a whole full-fledged hospital, but be a telehealth nurse. So I thought that was amazing. And I found an article that I was reading that kind of had something to do with this. So I wanted to go over with you guys. As you know, I always try to give nurses alternatives that they can do in order to, bring down the burnout and ignite your creativity and get you to live the life that you want. So for those who are just tuning in, who don't know me, my name is Crystal Parker, nurse practitioner, owner of Savvy Beauty and Wellness, where I specialize in IV hydration aesthetics, but I also coach nurses on how they can nurse differently, how they can take their skills as a nurse and put that into a side business in which you can take the money from the side business, work less hours as traditional nursing and bedside, take that money, grow your business, and also grow investments so that you and generations to come can feed off of that. I wanted to take a look at this article here. Now, let's see, I'm using a new streaming system, so let's see if I can do this correctly. But it's on why telehealth and nurses go hand in hand. So this article basically talks about, and this is by Dr. Corey Skurlock, and he's the founder of Equum Medical. I kind of did a quick search to look him up, and it looks like he does a whole like acute care. He helps with border patients. He helps companies bring down the wait times of the ER, and he does a lot of amazing things. I did not specifically find like a tab where he's hiring nurses, but I'm sure if you did more digging, you can definitely find that. But this article basically says how nurses are becoming burnt out. For entrepreneurs, as it says, the design of solutions that might mitigate the clinical challenges of maintaining or improving quality care can help solve the clear customer dilemma of an increasing volume of higher acuity patients and a smaller direct workforce. So what he found is that nurses are being burnt out because of decreased job satisfaction, not enough pay, especially after what we went through with COVID, lower job satisfaction, also the number of workforce that is leaving the hospital. Even before this, we had the baby boomer age who was slated to retire from nursing, but there wasn't a lot of nurses in nursing school to help reach the demand of the nurses who are leaving the bedside, right? So then when COVID happened, nurses then were scared to even go to nursing school because they saw what we went through with COVID, all the people dying, all the ventilators, the decreased pay, and it just did not make nursing look to be the desirable profession that it once was, right? We are still trusted. It is still a good profession when you think about the money that could potentially be earned. But then when you get into the entrepreneurial mindset, you know that trading time for money is not what we are doing here, and you can make much more money in less time. But I digress. Those looking to go to nursing school were like, we ain't going, especially looking on the news and seeing all that nurses were going through and having to deal with. So that's what this article is essentially talking about, the burnout and how there aren't enough nurses to replace those who are leaving the bedside. Telemedicine might be something that will help everybody. So with nurses who are experienced but do not want any more direct patient care, they can do a whole host of things with telemedicine, including one that I found interesting, which was actually on the job training for new nurses coming in. You can be an experienced nurse and actually come in with maybe a new nursing student or a new nurse who is coming onto the floor, and you can actually help them throughout their day, help them to become more confident and help them to be the best nurse that they can be for the patient. So virtual nursing can increase, as it says here, flexibility, reduce some of the friction points in daily treatment, and incorporate better administrative support for nurses on the front line, allowing them to rediscover the reasons why they became nurses in the first place, right? Because a lot of times we're by ourselves, we're in the trenches, and what do you guys ask yourself? I know what I was asking myself: why did I do this? How can I do this for forever until I retire? There has to be a better way. Telehealth was traditionally seen as doctors being able to meet with their patients and fill gaps for rural and community hospitals, but now telehealth and telemedicine has taken on a mind of itself, and it's here to stay. If you think that it's going somewhere, you are highly mistaken. Telehealth and telemedicine is only going to increase and get better. So it says here that reputable telehealth companies hire dedicated, experienced nurses who take on many important tasks, allowing bedside nurses to focus on the art of nursing, right? Isn't that why we got into nursing? The art of nursing, the skills, the critical thinking. That's why we got into being a nurse, not so that we can spend hours upon hours, stay late after we've already done a 12-hour shift, charting to make sure we got all of our T's crossed and all of our I's dotted on everything that went on throughout the day. Because why? They scare us that if it's not charted, it wasn't done, and that we could potentially lose our license. So for many of us, I know for me, that was a lot to deal with, and it ultimately increase my burnout and decrease my job satisfaction. Different things that tasks can include, not limited to, collaborating with the hospital's ER to reduce wait times, reviewing orders, and making calls to facilitate access to labs and imaging results. Don't these all sound like things that you can definitely do from the comfort of your own home? During the hospital stay, being a second signature for medications and blood administration, you're running around looking for someone. Wouldn't it be great if you can just pop on a call and say, hey, can we do this check and you double sign my blood? They can discharge patients, which we know that sometimes, especially as ER nurses, we are waiting all day for the floor. And I'm not trying to start any ER floor wars, but I'm just saying that it's kind of funny how all discharges happen around 3 to 5 o'clock, but there's nothing that happens before. But anyways, we can have these telehealth nurses who can come in and help with the discharge issues. As it says, there isn't a problem finding experienced RNs for virtual nurse jobs. The same study found that 35% of RNs who were likely to leave their current roles indicated that they wanted to stay employed in healthcare, because we're nurses. Our heart is in it. We went to school. We live and breathe nursing. So we want to be employed in healthcare, just not in direct patient care roles. And being able to work from home and set our own schedules is another draw that draws nurses to telehealth and telemedicine. It says for providers of care, these burnt out nurses can be invaluable resources as healthcare enters a post-pandemic era of complexity, scarcity, and change. So hope that article helped you just to start thinking of other ways that you can be a nurse and other ways you can use your nurse degrees. You just have to go out and search and find these positions. I hope you learned something. If you want me to review any other kind of articles, this article was found in Forbes, and it is titled Why Telehealth and Nurses Go Hand in Hand. So look Dr. Skurlock up, see if he might have any positions for you. Again, I will try to reach out to my student and see if we can have a chat about how her telehealth nursing experience is, because it seemed amazing, and anything that you can do from the comfort of your own home, having flexibility to be able to hang out with your family and friends, is the kind of life that I want to live. So that's all for now. I hope to help, and I'll see you guys soon.